What is the success rate of inguinal hernia repair? So, hernias have a tremendous amount of surgical literature, studies, and research, which is readily available by looking through pubmed.gov. And so there's a variety of numbers. I'm going to share with you some numbers and then I'm going to add my opinion to the mix. So the published rates of inguinal hernia recurrences is anywhere from less than 1% to 10%. In general, with modern repairs with mesh and robotic techniques, seeming to be 1 to 2% or less. Now, and just to counterbalance that, non-mesh repairs generally have had higher recurrence rates, maybe around 10 or even more percent. But then there are studies from the Schuldeis Clinic, and there are also more recent studies using the Desarda repair, which show them to be equivalent to mesh repairs and put them down in the 1 to 3% recurrence rate. My opinion on all of this is, for whatever it's worth, it's another opinion, but studies inherently have some limitations. Really, the follow-up for a hernia should be a lifetime, and it can't really just be limited by 1 year, 3 years, 5 years, or even 10 years. It really needs to be a lifetime. And adding to that, there's just the nature of a weakness in the floor, and there's an element of it, even if a hernia recurred decades later, a question of how have things changed with the patient's weight and exercise and general tissue quality. So in my mind, when people ask me what is the recurrence rate of hernias, I tend to use higher numbers. Now, my personal numbers are low, as are most hernia surgeons. But like I said, I think to get really good numbers, you need to follow patients over a lifetime and have tens of thousands of patients. So when I tell patients, this is kind of how I think in my mind. The rate of recurrence for an inguinal hernia repair, I think over a lifetime with mesh is probably 1 to 3%. And with no mesh is probably a little higher. I think in my mind 2 to 5%. These are just me looking at all the data and what I know of statistics and studies and the human body, and adding more, a little bit higher numbers, because there's probably things we're missing over the course of a lifetime. So the general sense is, though, most patients should be fine. Recurrences are not that common, but when we do so many operations, we do see them because there's so many patients. Usually a recurrence doesn't happen soon after surgery. That would be likely, we think of that more like a technical failure, error in technique, or some extenuating circumstance. Someone had some unusual lifting episode or something in the early recovery period. So for the most part, we're not really seeing hernias come back within years. They might come back years later. And I tell people this idea, think about a 5% recurrence rate. Of course, something that's really important is trying to optimize your overall health before hernia surgery if possible. We want to get you in the best shape for surgery and stay in good shape. And that means no smoking, be at a good weight, don't be constipated, be fit, have a strong core and an exercise regimen, and have a healthy diet and get good rest and manage your stress and all the things that go with having a whole healthy lifestyle. So I hope that helps. In general, very low recurrence rates, and probably some slight differences that could be parsed out over following patients for a lifetime and with thousands of patients.